morning, my dear faculties. I am Darshi Trivedi. I am pursuing B Physiotherapy from the Marwadi College. Today I will be presenting in the kinesiology structure of the hip joint. So let me. Today is my friend is this anatomical structure that helps us to present the how it will be the hip joint structure will be formed. So first there is the pelvis. This is the hip bone of the right side, that all we get to know. So the hip joint is also known as a coxa femoral or temporoacetabular. This also known this is other name of the hip joint. The type is ball and socket variety of synovial joint, and the degree of freedom is 3 degree of freedom. So this is the hip joint we get to know. So the how it will help us to the articular surface. First there will be the proximal articular surfaces. 1 minute. This is the major, basically anatomical structure of the hip, femur bones. So the first there will be the articular surface, proximal articular surface, and the distal articular surface. In the proximal articular surface there is an acetabulum lunate surface, acetabulum notch, acetabulum. This all kind of structure we get to know, we get to see in this acetabulum fossa, acetabulum labrum, and in distal articular surface we angulation of the femur, how the femur is angulated in the hip related to hip joint, angle of insertion, angle of torsion. For the proximal articular surface, first is the acetabulum concave cup socket belt of lateral aspect of the pelvis bone. So we get to know the here there will be the iliac, that the lateral side of this is an iliac bone. We know this is the pubis and this is the ischium pubis, and this there will be the lunate surface. So the structure of acetabulum is an ilium 2/5 and ischium 2/5 related to the ear. We can see ilium, between the ilium and the ischium. This is the pubic body of the pubic. This is the acetabular notch. We get to know this is this is an acetabular notch. This is an acetabular notch. This is an acetabular fossa. First we will see the what is the acetabular notch, how it's connected to the femur. So it is acetabular notch. Here we can see the structure. I will be presenting in the 3D. So the acetabular notch is an inferior aspect of the lunate surface, and the acetabular fossa is the deeper portion of the acetabulum. So this is the acetabulum. First we will get to know this is the acetabular notch, and second is the acetabulum fossa of acetabulum. We can say that. Let me see from the what are the acetabular nodes, no. This is the acetabular notch and acetabular fossa from the lateral view, posterior view. So acetabular labrum is in the beside that. So first this is acetabulum lunate surface, acetabulum fossa notch. So this whole the hollow passes an acetabulum. The acetabulum labrum. So the between the femoral head and acetabulum. So between that between the head of the femur and femoral head and the acetabulum, there will be the labrum. Labrum is known as acetabulum. Labrum is a fibrous. We get to see. So labrum. See here. We see fibrous. Fibrocartilages deepen, socket, and increase concavity. That is 4-5 properties of the acetabulum labrum act as a seal to maintain negative intra-articular pressure. It maintains the negative intra-articular pressure to the femur and enhance the stability. Stability of the bones are enhanced by that. This. So now we will distal articular surface. In distal articular surface, first there will be the head of the femur. So this is the head of the femur. So now we will know about the angle of inclination. Showing the angle of inclination, frontal plane, and it's formed by the axis through femoral head and neck. So from the femoral head of the femur and neck, here there will be the angle of the inclination we can see. So there will be the normal anatomy. Normal value is 2.5 degree of this angle of inclination, and range will be the 110 to 145, 144. So there is a two terms, coxa valgus and coxa varus. Coxa varus and coxa varus. Coxa valgus is a greater medial angulation, and coxa varus is a lesser, smaller medial angulation. So medial angulation, we can see here how the medial angulation has. This is the coxa valgus and coxa varus. So coxa valgus is angle of inclination more than 125 degree. So normal value is 125 degree. More than that is a coxa valgus, and less than that it's less than decrease angle between neck and shaft of the femur, means less than that. See, there is an angle between head of the femur and neck. It's in 125. More than that is a coxa valgus, and less or distance less than that is a coxa varus. Decrease in the amount of courage from head. If it is increased, then what are the recent things we can see, and if it is less, then what things we can see. Now is the angle of the torsion. Occurs in the transverse phase and formed by the axis passing through femoral head and neck. So the angle of inclination isn't in the femoral plane, it is in the transverse plane. Torsion is in the transverse plane. Both we can see in the neck of the femur and head of the fibula. Both angles we can see in that. Now what are the ligaments we can see? Now one of the is hip joint capsule of the hip joint. So irregular descent fibrous structure longitudinally and oblique fibers with 3 thickness region. So it's an irregular. See, we can see that the hip joint is an irregular, hip bone is an irregular bone. So the capsule in that is also an irregular fibrous structure, longitudinally and oblique fibers. Zona orbitalis anterior superiorly, posterior inferiorly, capsule covers. So these are all the regions of the joint capsule, hip joint capsule. Now the ligaments. So the ligaments are formed here. First is iliofemoral ligaments. The ligament between the ilium. Let me show you. Between the femur, the ligaments one is right here, it's an iliofibular ligament. It's a wide ligament anteriorly we can see. Second is a pumiofemoral between the uh, pubis and femur. We can see the ligament is a pubiofibular ligament, ischiofibular ligament. Let me show you. We can see from the ischium and femur. There will be one ligament, ischiofibular ligament, and ligamentous teres, the ligament of head of the femur. One of the ligament is there in the head of the femur. So first will be the between the ilium and fibula. Second is the between the pubis and femur. First there will be ilium and femur. Second is the pubis and femur. Third is the ischium and femur, and fourth one is the ligamentous teres between the head of the femur. So this is the structure of hip joint is there. Thank you.